Hi, Leslie. Thank you for joining me today to talk a little bit about your ventures. Would you just quickly introduce yourself?
Hi, Fatima. Yeah, thanks for having me. Yes, my name is Leslie Asanga. I am a pharmacist and a recent graduate from the Yale School of Public Health. And so I'm originally from Cameroon, moved yeah, to the U.S. in 2010 for school. Have been going to school ever since, and now I am working on uh, entrepreneurship, working on my ventures that started.
Great. So, can you just give us one or two sentence summaries of each of the two companies that you're currently running?
Okay, I would start with UrPharm. So UrPharm is a mobile app that helps people in sub-Saharan Africa to be able to easily um, find and purchase medications, because in a lot of places you have to go through a lot of times like 10 to 15 pharmacies to be able to find a single medication, because there's a lot of areas where, especially the rural areas, that do not have enough medication supply. So in the course of that, people spend a lot of money that they don't have in the first place, and time, and some people even lost their life in the process. So we're happy of the impact that your farm is currently having on the lives of people. We just launched in Cameroon, and we are scaling, and we're expanding to many regions in Cameroon, and hoping to start expanding to other African countries by the second quarter of 2021. And then Pills2Me is an on-demand prescription delivery service, which helps for the goal of Pills2Me is to help people with medication adherence to be able to. So we connect patients and drivers, and they get their prescriptions delivered in as little as 30 minutes. The goal, even though we're starting with prescription delivery, the goal for Pills2Me is to make pharmacy services accessible virtually. So we're trying to make it so that people can access pharmacy services without having to physically go into the pharmacy. As the world is changing, almost everything else is going virtual, but pharmacies is still lagging behind. So we're looking to be that leader in in going in helping people access those services virtually, starting with on-demand prescription delivery. Because again, I always say, if you can sit at home and have your pizza, order your pizza, have it delivered to you in like 30 minutes, 45 minutes, then why can't you be able to do that with a medication which could potentially save your life?
Absolutely. Thank you for giving us that quick overview. And so, tell us what drew you into social entrepreneurship? Like, what made you want to innovate and create something new?
Um, so um, Normally I'm a natural, entrepreneur. I was I can't say I got into entrepreneurship a little early, not out of it was more out of necessity, So uh, when I graduated high school back in Cameroon, top of my class, while my friends were going to the university, I couldn't, because I couldn't afford it. So, and then unfortunately my mom passed, and I had to take care of my siblings. So that's how I started entrepreneurship. I started doing some businesses, and that kept me and my siblings afloat. And then 8 years later, after I had saved enough money and I could afford an education out of the entrepreneurship work that I was doing, I I then got admission, and then came to moved here in the US for school. So entrepreneurship is always, I just started it out of like necessity, but it's been like, my something I've been doing all my life. So when I got into pharmacy, I've graduated pharmacy school. I was working as a pharmacist. I, I saw a lot of inefficiencies. I saw a lot of, problems that could be solved in the pharmacy sector. And also I reflected back after having gotten all these knowledge that I've gotten from the US, and started thinking back, like, how can I translate these back home to help people in Cameroon? And and so, I decided to get another degree in public health. That's how I got to Yale. And so I could, kind of mix my knowledge in pharmacy and public health practices to be able to impact people's lives. So yeah, so that's how so, I kind of got into the social entrepreneurship part by just having a lot of knowledge in the healthcare, and then thinking about the inefficiencies that is impacting people's lives both here in the US and back in Cameroon. And I decided to to figure out to see if I can do something as to play my own role.
Great, thank you. So you touched on this a little bit, but what kind of inspired this idea for your venture? And you have two. So what kind of sparked this idea for your farm, and then the same thing for Pills to Me?
So you're from the kind of like two separate things, and they kind of spawn came up in two separate ways. So the first, which we started working on, me and my childhood friend Suki, it was your farm. So we got on a phone call one Saturday, and so, so he called me. He actually called me, and he said, man, you're a pharmacist, and I'm a software guy, and I work for IBM, and we develop all these cool softwares. So could we think of a way that we could, use all this, our knowledge, combine them, we do something to impact people, to impact people's lives back home in Cameroon. So yeah, and I had been thinking about this farm how to impact the pharmacy space in Cameroon. So I was like, wow. So it was just a good idea, and then I was like, it looks like this is like that was like a perfect, timing, perfect conversation, and we just thought through about the problems that we ourselves face back home in Cameroon. Having to uh, that lack of access to medications. We personally know people that died because of lack of medications, and even living abroad, we also go through that problem of trying to send money back home for people to buy medications, and having used to use Western Union, MoneyGram, and all of that to, paying high transfer fees. So so that kind of like, sparked, and we were like, okay, it sounds like a good problem that we could solve to help people back home. And then it was more of like just like something to help. It wasn't more of even like a venture that we were just like, okay, let's do this. And then we were going the nonprofit route, and then after I like did a lot of studies on nonprofits, and how you need to keep going back to donors every year, and looked at a lot of nonprofits that have started in Africa, and the reason they fail was because of lack of continuous funding. So we kind of thought of a way that we could do it, or we can build like a sustainable, self-sustaining business, self-sustaining business, and as in like generating its own revenue, and getting, helping people at the same time, without having to depend on outside donations. So that's how um your farm came about. And then yeah, Pills to Me was, as the pandemic hit, I was working in the pharmacy. I saw there were a lot of like immunocompromised and elderly people coming in this packed pharmacy to pick up their medications despite recommendations for social distancing. I got I got to talk with a few of them and ask them why, they had to take that risk and come. And um the theme that I kept getting was that a lot of people did not have uh reliable caregivers. So they said they needed their medications, and so they have to have it somehow. So we just started again as a volunteer service, recruited students, most young and healthy people to help, you know, pick up prescriptions for the elderly and immunocompromised so they can maintain social distancing. And then after that, we we got calls from people saying, "Hey, I'm not immunocompromised. I'm not elderly, but I would love to use this service. How much would I pay?" So we were like, "Oh, we could not build this into a company." And then that's when I went into doing some market research on my own, got into the medication adherence problem, access to pharmacies, uh, you know, and prescription abandonment. And it was a whole lot of things that I uncovered, coupled with, things that I had experienced in the pharmacy myself when I was working full time as a pharmacist. So we just decided to build it as, a company to that can literally bring the whole pharmacy to you. That's why our slogan says, bringing your pharmacy to you. So it's not just prescription delivery, but it's a whole lot of other things that we're trying to accomplish.
Thank you so much for sharing all of that with us.
Yeah.
So, where do you see each of these ventures, headed in the next 5 years? Where do you think you'll be?
Yeah, so yeah, that's an interesting question. And yeah, I've done a lot of projections. I've done a lot of like studies on that myself because yeah, um and it's very interesting because when I look at it, when I look at the impact that we're already having, yeah, at this very early stage, and the things that we're capable of doing, especially let me start with your farm, the impact part of it. Like, when we first released the app and we told people that, okay, there's this app that, uh even our beta users, we're testing the app, we already, from the testing part, people already started sharing. Like, we started getting complaints from people like, "Oh, I tried to find this pharmacy but I couldn't find it." Like, yeah, it's the beta testing. We didn't even know you even, it's not in use. So it was just that it was a burning need. We figured out it was a burning need that people were things that people were going through. So the way I see this, like in the Your Farm, I see Your Farm becoming like I would say the Google for medications in sub-Saharan Africa. Like, at least in the next 5 years, that's a big, like, long-term vision. But in the next 5 years, I see us, in being like that first place where people go to search medications in Cameroon. I'm looking at Nigeria, Ghana, and Kenya for now. Those are the ones that we've done some market research on, and we're getting ready to do some market penetration. And so yeah, I see that's where I see it as, that reliable source where, if, for example, in Cameroon, you search your medication on Your Farm and you don't find it, it's not available in Cameroon. Yeah. So, and then and then yeah, and I see it being, used as a tool, public health tool, to be able to impact a lot of, like, millions and millions of lives in the countries and the regions that we plan to serve. And for pills to me, pills to me, again, I see pills to me as, becoming that, leading the way in providing virtual pharmacy services, where you can go, that source where you could go, instead of going to Amazon and purchasing, let's say, an ibuprofen or over-the-counter medication, or going to Google and looking at all, googling information about side effects for a new medication that you've been prescribed. I look at this as one, as that source where people would consult to be able to get reliable information from from their pharmacist, from a licensed professional. So in the next 5 years, the goal is for us to, right now, where we just launched the full service in Las Vegas, but we're looking to be nationwide by in the next 4 to 5 years. So So yeah, we're looking to go all 50 states by then, and then of course become that reliable source for people who can like, we don't want anybody to miss a dose of their medication just because they're stuck in a Zoom meeting, which is the new normal, or they're stuck at work, or whatever they're doing that's preventing them from getting to the pharmacy. It should be something else. And yeah, so yeah, we're that's where I see both companies being in the next 5 years.
Thank you for sharing that. So, can you tell us a little bit about how your time at Yale shaped your ventures? Specifically, how did IHY Innovate Health Yale kind of play a part in your work so far?
Yeah, so I mean, I'll tell you, there are a lot of things that I know now that I didn't know, like, I would say 16 months ago before I went to Yale. Yes, I was an entrepreneur. I've done some things myself, you know, here and there, but I kind of, when I went to Yale, I kind of immersed myself in that entrepreneurship, that startup ecosystem that helped me, interacting with other founders, and then taking elective classes on social entrepreneurship and startup founder classes that kind of open my mind up to whole lot of other resources that could be used, and all of that. And I'll tell you, before that, like, I thought that starting a business, you either are very rich, or you get a bank loan. Those are the only sources of funding that I know. Venture capital was nothing. I had no idea what that was. I mean, I had studied them in business school, but it sounded like some other people's thing. It didn't look like something that I could be a part of. So so yes. So while at Yale, interacting with Innovate Health Yale, I mean, we talked like almost like once a week while I was there, and just running those ideas, having those people available to answer certain questions, just to bounce back ideas back and forth, and providing you with those resources, with providing me with the resources that I needed, was, I think, it was something that um but I mean, it's invaluable. I can't even really attach you know uh, enough value to it, because it's yeah. I mean, thinking of, like, I would say, the short story about it is that without the resources provided by Innovate Health Yale and all of that, I wouldn't even be dreaming as big as I am right now. So, and I don't think any of these these ventures would be where they are today, right? Like your farm, for example, that uh all the funds that we got from the Thorn Prize that started Yale was used for your farm. And in hindsight, looking at it, I'm like, I just thought we were crazy what we were doing, because that was like a big booster. Like, yeah, the kind of the money has gone a long way to solve a lot of obstacles, a lot of problems that we had, that I was like, I don't know what we would have done without that. And then of course the mentors we've gotten, like you, Cave, and even Constantine at Sci City, all those things. I mean, that I think those things have been crucial for us becoming getting where we are. And again, a lot of the resources are still helping us move forward with, like, getting uh, funding, connections to venture capitalists. So yeah, I mean, I can go on and on with everything, but yeah, it helped us. It helped me get into that startup ecosystem. It helped give us that jumpstart everything, and it's still helping up as we speak. So the resources and everything is still helping us.
Thank you, Leslie. Uh, and my final question is, what advice would you give to future entrepreneurs?
That's a vague a vague question. Like, because I could think of 1,000 things right now, but I would say the biggest, and one thing that I've realized myself is that a lot of a lot of people start a venture by wanting to. A lot of people that I've met, they when that are trying to start a venture, they're trying to start a company straight off. They're trying to start a money making thing. Like, a lot of people start up with focusing and spending a lot of time on the business model and all of that. So my greatest advice that I would give anyone starting is trying to solve a problem, you know, trying to solve a problem that people really care about. And that should be the goal. The goal is solving a problem you're passionate about, because because yeah, everything else will kind of fall in place if you figure out a genuine problem that you're solving, right? And yeah, and it helps you too with kind of like the problem of product market fit. Like, if you go from a problem, identify a problem, and doing customer discovery and figuring out a lot of people care about that problem, then the rest will just fall in place for you. And again, when you're passionate about it, about what you're doing, it gets you through the rough days. Because there I mean one of my mentors actually told me, like, one of the things, like, everything that you think could go wrong will go wrong. The problem is how you deal with it. Everything that you can imagine that can go wrong will go wrong. So, but the one thing that keeps, keeps, I mean, entrepreneurs, like the people I've talked to, the most successful entrepreneurs that I've met, what the one thing that keeps them going is the passion for the problem they're solving. Even me myself, the times that I get through difficult times, obstacles, and then I'm like, man, what's going on? But because I know what I'm solving, what I'm doing, and I'm passionate about solving that problem, and I know a lot of people will be impacted by it. That keeps me going. So I think that would be the biggest advice. It's like, start with a problem. If you want to get into entrepreneurship, it should be a problem you're solving. Yes, there are lifestyle things that you could do that could make money. But in the social entrepreneurship space, yeah, you should be solving a problem, and then be passionate about it.
Great.
Yeah.
Well, thank you so much for your time, Leslie, and we really appreciate you and are excited to see the amazing things you continue to do.
Yeah. Thank you so much. Thanks for having me.